Hi, this is Dr. Gary Sykes, and a popular question is, has being an obstetrician, the practice, what I do, changed very much over the years? Well, I've been doing this for a long time. I'm one of the most senior obstetricians in Sydney. By that, I'm one of the most experienced. I've done far more deliveries than the large majority of my colleagues. I don't know exactly how many. I don't believe any obstetrician goes home every day and puts a tick, yes, one more today. So I don't think any obstetrician knows how many, but I would venture to say I've done 15,000. That's a lot. Many years of wonderful experience and wonderful times with patients, but it has changed a lot, hugely. Back when I started, we didn't have all the modern technology, so you didn't have the ultrasound scans, for instance. Ultrasounds were done externally, and the equipment wasn't that good, so the accuracy wasn't that good. We assessed the uterus, with the fundal height of the uterus at every visit. Mind you, that's what's done in the public system these days anyway, but as a private obstetrician I find that very old-fashioned. We tended to do more difficult vaginal deliveries. That's because a caesarean section was considered a last resort. The caesarean section rate was around about less than 10%, 10% roughly, yes. And so we did a lot more operative vaginal deliveries when the indication was there. It's interesting because there were a lot of difficult forceps deliveries back in those days. Vacuums were not that reliable. That's changed a lot. I'm comfortable using forceps, but I certainly don't want to do difficult forceps deliveries. What we do these days is the caesarean sections, because caesarean sections become a lot more popular, and a lot of those difficult vaginal deliveries have now turned to a caesarean section. Hence, the caesarean section, one reason the caesarean section rate has gone up. We only do the easier operative vaginal deliveries these days. Certainly with babies that are breech, in the past they were always delivered vaginally, but these days they're not, and that's because it's well established that a breech vaginal delivery is more dangerous than having a caesarean section delivery for a breech presentation baby. We had more preeclampsia, I believe, in the past than we do now. I don't quite understand that, but I was chatting to a colleague about that. So there's certain conditions. I think our management of various medical conditions have improved immensely, which is really good in the patient's interest. So certainly pregnancy and childbirth have become a lot more safer for women than what they were in the past. We had very few epidurals back then, so you'd have women who had difficult vaginal deliveries with what we call a pudendal block, just a bit of local anaesthetic blocking the pudendal nerve. That was very uncomfortable for women, but that was the only option back then. I could go on. There's been massive changes, but certainly I believe the trend is towards a much more positive experience for women, a much safer experience for women, safe for them and their babies. So I'm excited about the changes that have occurred. And certainly I think there'll continue to be changes, but we're certainly moving in that right direction. Hope that information helps, and look forward to speaking to you soon. Bye for now.